Today is April 14th, and this is COVID-19 Local Impact Ottawa Valley. I'm Trevor Riley. Here's a look at the COVID-19 situation at the last update of April 14th. We have no new confirmed cases in the county, which keeps us at 14, and no new deaths, which sits at 1. Total tests done here in Renfrew County sit at 803, and an increase in negative tests coming back to 618, and we are currently awaiting the results of 171 tests. In the province of Ontario, the numbers of cases went up by 483, bringing us to 7,853. That's a 6% increase from the last report. 334 deaths have been reported, and the total tests have now reached well over 113,000 at the 10:30 a.m. update on April 14th. On April 13th, the fire departments from North Algona, Wilberforce, Petawawa, Laurentian Valley, and Pembroke displayed their support to the hardworking staff at PRH.
I think so. I think it's just nice, a lot of the staff members are sort of feeling isolated in more ways than one. And I think, when they see things like this, they realize, hey, this is part of a huge, worldwide phenomenon that's taking place. It's definitely something, and I think it means a lot for them to realize that the community is reaching out to them and recognizing it. Thankfully our community hasn't had an incredibly bad situation yet, but who knows what the future is going to bring. So I think right now, we've been in sort of pandemic crisis preparation mode for a few weeks now. So I think it's a good time for people to say, hey, thank you, and I think it does mean a lot to staff because all of their lives have been sort of under upheaval in various ways over the last few weeks, like everyone else's. Definitely, we've been getting a lot of public donations, and all of that is being inventoried and basically assessed in terms of what we can use immediately, what we can put aside for a day when we actually do need it. And all of it is definitely going to help our community at a time when, if things do ramp up, which, given the circumstances, most likely they will. So I think this is definitely something, we rely on the province as much as possible for supplies to come through to our hospital. But as we know, it's a worldwide shortage in different things. So whatever we can use as backup plans is really appreciated and will most likely get a lot of use. And it again just sort of shows the warmth of our community and everyone pulling together in a really challenging time. Still sort of looking for, the N95 masks, even expired ones we can use in different ways. The surgical or procedure masks, latex-free gloves, those are still sort of the main items that will get a lot of use because they're regularly used by all of our staff. So I think everyone definitely is sort of feeling a little more tired than normal. Definitely everyone's dealing with changes both on a professional and a personal level. So I think, overall morale hasn't been really bad right now, which is a good thing. I think definitely people are getting used to the fact that every day is bringing new change, and so it's a lot for everyone to have to step up to that. But I think right now everyone is stepping up to that challenge as well.
I think I'd ask you another question, but yeah, I probably wouldn't be able to hear it.
Coming up after the break, one of the most difficult situations we find ourselves in during this pandemic is how to talk to our kids about what's happening. We spoke with a Muskoka-based counselor to get the tips on connecting with children. Welcome back. We connect with a Muskoka-based counselor to speak about the effects and the difficult situations we have speaking with children about COVID-19, and we're going to share a part of that interview with you right now.
Well, I think what's most important in all of this is understanding the age category. So for our kindergarten children, are basically our pre-grade 1 children, primarily it's more about parents paying attention to their own mental health and to their own behavior, because children that are high level of linguistic ability understand their world through the adults that surround them. So the behavior of the adults around them is how they determine their own behavior. So the more anxious we are, the more disruptive things seem to the children around us, in particular young children. That is how they determine whether there's a problem or not, because their linguistics aren't quite there to understand. We can use terminology of, it's a bad bug, it's a nasty bug that likes to travel around. They can get some basic understanding on that, but primarily the way in which they're understanding the nature of this problem is through the adults that surround them. So the more calm that we stay, and in particular, the more that we stick to normal routines, sticking to breakfast when breakfast is normally served, having nap time when it's normally nap time, doing things as normally as possible is how we manage the anxiety that may be transferred or maybe, perceived by the kids that we're taking care of. The teens really don't quite understand this, but just in a slightly different way, in that they're not highly impacted by it. If they have a job, if they're a teenager where they do have a job, perhaps they've been asked to stay home, and they might understand that some of the gravity of that. For most of the teens that don't have jobs or work, there really isn't yet any real significant impact for them. So it's trying to reinforce to them staying clean, washing their hands. But again, they do still feed off the perception of what they see their parents going through. So the calmer we stay, really the better. The challenge where we're going to see some mental health difficulties or differences is really in that middle range. So they're not fully teenagers yet. They're not kindergarten or even grade school. They're right in that middle school area, and they will see significant impact, just in the sense that the programs that they might have been involved in, if they were doing day camp or if they were doing things of that kind, and obviously they can't go back to school, they will see probably the most amount of disruption. So for them, it is having a semi-adult conversation of we're okay. Everybody really is okay. Obviously not those that are vulnerable, but that reassurance is important. Trying to keep them busy, give them household tasks, give them things that they can be proactive in trying to be part of the solution. this is always a good thing for children, to give them the ability and reinforce to them that, even if you give them a task of cleaning their bathroom, that was helpful, and reminding them that they've been helpful and that staying clean and doing all the necessary measures are part of the whole process. So it's an empowerment thing, because where that middle ground tends to have challenges is that they feel disempowered, or they feel that they have no ability to help. And giving them positive reinforcement that they are helping is really significant and very helpful to their mental health.
Make sure to stay up to date with your TV and stick with us through the pandemic. We will continue our coverage of the COVID-19 Local Impact Series every weekday right here on Channel 700 at 5 p.m. And it'll also be available on our website at yourtv.tv/Ottawa Valley. We hope you are staying safe wherever you are watching. We are in this together, and we will get through this. Thanks for watching.